I am a registered nurse. I've been an LPN for 10 years before that. I picked the opioid crisis because so many of my family and friends are dealing with relatives, children, mothers, fathers, sisters, brothers, everywhere you look. And I know some of y'all probably have experienced it too. Everywhere you look, there's just a crisis. We have patients who are addicted to opioids, and it's just an epidemic. So this is something that plays very deep into the soul of who I am. My brother's drug addicted right now. My kids are dealing with drug addicted family members also. So I did a little bit of research, and this bill just got introduced in April by Senator Lamar Alexander. Of course, he's the Republican from Tennessee. Currently, I live in Louisiana, but my heart is still in Tennessee somewhat. He partnered with Patty Murray to write the bill and do some work on it. It's the Opioid Crisis Response Act of 2018. Right now, it's just a draft bill. It was introduced April the 24th, which is just a few days ago. It's 149 pages long, so it is significant. There's a lot to it, and we're going to be going over that in just a minute. The status right now is it's ordered reported, which means that they've kind of done a little bit of work on it. They're actually saying that there's a 39% chance of enactment in the next couple months. So hopefully it'll be passed by the end of the year. Tennessee ranks in the top 5 states with drug addiction. I knew it was high, but I didn't realize we were that high. And of those, 67% are male and 33% are female. Tennessee was set to receive $13.8 million in funds to help fight the crisis in 2017. And as we all know, it's not enough. You know, we could do lots and lots. And there are 6.6 million Tennesseans, but there were 7.6 million prescriptions written for opioids last year. So it's a lot, and it's caused 64,000 deaths in 2016. That went up in 2017. In the county that I was living in Roane County, we actually had to call in coroners from other counties because it was getting so bad. People were dying in the streets, literally, in Rockwood, and it was all over the news. Lamar Alexander has actually said in a press release that this is our most serious public health epidemic, and despite our efforts, it's just getting worse. And so this is a bipartisan, urgent, and effective response. We need to be on this, and we need to be fast, and we need to do something about it. And sometimes it's unfortunate that we have to deal with a crisis rather than prevention. I'm a big prevention person, but that's where we are. I don't think anybody ever expected as many people to get addicted to opioids as what they have. So the background of this bill is that it was the result of 6 hearings over the last 6 months. It's bipartisan, which means the Democrats and the Republicans are supporting it. The deaths are actually rising from opioids. It's up by 28% in 2015. And the House Energy and Commerce Committee are also working on another package, and they hope it to be up by Memorial Day on the House floor. It modifies several existing bills. It includes Jesse's Law, which, if you know anything about that, that's a law that if a physician can give a patient a diagnosis of drug addiction or opioid addiction, that way it prevents another physician from giving them another prescription and then them ultimately passing away from it. So it kind of helps with the knowledge, you know, if my patient is dealing with and he doesn't come to me honestly, and they don't, a lot of times they don't come to you honestly, and you can doctor shop, as it's called, then that helps with that. There's several additions. This law is kind of in depth, and it goes over a lot, so I'm just going to be hitting the highlights, and it's all encompassing. I mean, it includes the DEA. It just includes about every aspect you could think of, and I'm really supportive of this law. It allocates $1 billion in funds And I didn't finish that right there. I don't know. It addresses things like border protection, what the people at the border can do to prevent people from bringing in drugs. It deals with prescribing, what physicians can do and can't do, just like Jesse's Law. It deals with giving first responders education on how to deal with the crisis. There's grants for recovery centers, comprehensive recovery centers. It allows the NIH, the FDA to do some things. It talks about safe disposal systems where if you've been prescribed a drug and you don't take all of it, you can bring it back and do some things with that. There's prescription limits and public and provider education. It also deals with neonatal abstinence syndrome data collection, which we know in Tennessee is a crisis. We have lots of babies in the NICU at East Tennessee Children's who are dealing with this, and it allows the data collection so that way we can help in the future. And then the DEA, the family support for addicted individuals, and then the data and technology part of it, the IT. And there's a summary listed here that you can go to that kind of summarizes it all, and not in 149 pages. The purpose and summary of the bill is to improve the ability of the Department of Health and Human Services, including the Food and Drug Administration, the National Institutes of Health, the Centers for CDC, or the Centers for Disease Control and Prevention, the Substance Abuse and Mental Health Services Administration, and the Health Resources and Services Administration, as well as the Departments of Education and Labor, to address the crisis, including the ripple effects of the crisis on children, families, and communities. It's help states implement updates to their plans of safe care and improve data sharing between the states. Doctor shopping. We know that a lot of Tennesseans have left Tennessee and gone to Florida and got prescriptions. That's going to deal with all that stuff. Now I'm going to break it down for you, and like I said, it is very detailed. It's a large bill, so I've just tried to get the meat of it and give it to you. I definitely would say, as a healthcare provider, you need to look at this bill, and you need to email Senator Lamar Alexander and just let him know, hey, we support this bill, and get on board with this because this is important. For the National Institute of Health, it works with the ACE Research Act to increase flexibility for the NIH to approve high-impact, cutting-edge projects and use other transactional authority for research to respond to public health threats. They want to find a non-addictive painkiller, and that's the goal of this Research Act. Let's find something that's not addictive that we can give these people instead of this addictive medication. And a lot of these, if you see ACT in here, what it does is this bill adds to that ACT. So there's an ACT already in place, and this is just going to be added to that ACT. So if you wanted to know more about the actual ACT, you'd have to look that up. The Food and Drug Administration. Now we know that's the part of the government that really regulates drugs. So they've gone in and they've done a few things that will be specific about reducing the opioid crisis. Packaging. It limits prescribing, overprescribing, and it's going to set a treatment duration and give like a blister pack. You know, now if you go to the drugstore and the doctor's giving you a prescription for 30, you get 30 pills. Well, in this, you'll get a blister pack. And these are very effective in home health. When a home health nurse comes in and gives medicine, patients have their medicines in the blister pack. So it reduces that, and then it can go back to the pharmacy. Safe disposal systems, it's going to prevent it falling into the wrong hands, and it clarifies the FDA's authority to require manufacturers to provide patients a way of disposing of those drugs. It's going to improve FDA and Customs border protection. It's going to improve the ability to seize and detect illegal drugs. And it would ensure that the FDA and the CBP have the technology and the equipment that allows real-time data sharing. So if I'm trying to bring something across the border, which I would never do, and they caught me, then it would share that information, which is really important, because if I'm trying to bring drugs across and you catch me and ship me back to Mexico or wherever I'm coming from, I can just right now go and try again at another site, and that would stop that. And again, clarified development and regulatory pathways for new pain products. Just expedite it, make it opioid sparing. Just several different things, risk benefits related to misuse and abuse. And then what I really like about this bill is that it deals with mental health, which we know is a crisis of its own in our country. We don't deal with mental health, and so mental health and substance abuse go hands in hand. I can't tell you how many times I've heard stories of people who have gotten addicted to drugs after a traumatic situation in their life. They got molested, or they got raped, or they got beat, or something was going on at home, and then they reach out and they try a drug, and then they get addicted. So this is really important. It's going to focus federal funds on states and tribes that have been hit the hardest. And I'm just going over this because my time is getting close. It's going to provide full continuum of treatment for patients in the areas hardest hit, and it would authorize a grant program to establish or operate a recovery center. And that's important for Tennessee. Roane County doesn't have a recovery center, and I'm not sure that there are too many counties around that actually do. Housing, this is really important too. It's going to assist those who are recovering to get housing, because how many homeless people have we seen who are trying to get out of that cycle, and they don't have anywhere to go. They don't have a house, so then they get right back in. So it's just a nasty cycle, and this is going to help them break that cycle. Of course, we've talked about prescription limits. First responders, our first responders need to know how to deal with it, and so it's going to support them, and it's going to give them naloxone. We've dealt with that in East Tennessee. We're starting to deal with that, and everybody everywhere needs to be able to deal with that. And then it's going to do a youth prevention and recovery initiative to prevent abuse and misuse. In children, adolescents, young adults, it would require the Secretary of Health and Human Services with the Secretary of Education to disseminate best practice and issue grants for prevention and treatment of and recovery from substance abuse. And we know prevention is very important. The CDC is going to be involved. It's prevention for states, and evidence-based activities, prevention activities, controlled substance data collection to assess and respond to the crisis. It's going to collect that data, public and provider education. So we really need to focus more, I think, on the public education. Providers know that it's addictive. We need to help educate our patients and their families, and we need to educate the kids, and I'll deal with that in just a second. We need to educate the kids that are coming up with this. I talked about the neonatal abstinence syndrome data collection, and then it's going to deal with infections associated with drug use. Right now we know hepatitis, HIV, endocarditis, all these things that the hospital's paying for, because if you come in with endocarditis and you don't have insurance, guess what? We're taking up that bill. Support for impacted communities, interagency task force. It's going to be trauma and substance abuse related. It's going to support children and families who are experiencing, if mom is on drugs, she's got a baby, there's not a lot of resources for that baby once that baby gets taken up, and so that's going to help with that. There's a pilot program on delivery of trauma-informed practices, plans of safe care implementation grants addressing economic and workforce impacts. If you're on drugs, your only goal is to get more drugs. You don't care if your electricity bill is paid, and it's going to help with that. So Drug Enforcement Agency, it's going to do a special registration for telemedicine that allows people to be treated, and it's going to limit controlled substance that can be prescribed via telemedicine. It's going to improve the access to mental health centers and addiction treatment centers. Disposal of controlled substances by hospice care providers. It's going to allow them to do that. Right now, everybody's a little bit different. Medication-assisted treatment. That's a whole topic on its own. Data and technology, it's just going to do a monitoring program. Jesse's Law, like I told you about earlier. and confidentiality of substance use disorder records. I do believe that they still have the right to confidentiality, but I do believe that, we need to know that you've been drug addicted, just like we need to know if you have, anything that's going to affect you. Health Resources and Services Administration. There's areas that have healthcare provider shortages, and this is going to deal with that. Again, there's more education and training for providers. The fiscal impact. So they have appropriated $500 billion for each billion for each fiscal year 2019 through 2021 to remain available until we've spent it. And it's going to be divided evenly in the most needy areas. How this is going to be paid for, probably taxes and insurance premiums that are going to go up. And then there's going to be grants for the most affected. So that's how that's going to be allocated. But we're probably going to see increase in tax. But this is something that we have to do. We have to fix this. We have to fix this, and we have to fix our education system. Social impacts. It's going to change the way we practice. We're going to have new rules, new regulations, new policies, and new procedures. We're going to have to stop and think about what we're doing. The great thing is it's going to provide housing to those who are recovering. It's going to help those who have a history of addiction by helping us help them. We're going to be able to know that, hey, this person has a history of addiction, so maybe I need to address this pain another way. And it's going to improve access to mental health, which hopefully will reduce homelessness and help reduce this crisis. Again, my opinion, I believe in this bill. It covers just about everything that you could ask for it to cover. It's going to reduce the amount of prescription drugs being prescribed. It will enable agencies to act, have more ways to act, and I can see it actually helping reduce some addictions in the future. This is a picture of my 3 kids. My kids have been exposed to people who have had drug addictions. And so this is very personal for me. It's very personal for him. He lost his best friend. My other 2 children have lost loved ones due to this, and I see it every day. My recommendation for any changes would be putting in our education system counselors, licensed psychologists, psychiatrists who can talk to these children at home. We are in a crisis. And so in this crisis, we must deal with the youngest victims first, I think. And we need to help those drug addicted, but we need to deal with those coming up after them, because it's going to take a while to help us fix those who are already broken, for lack of a better word. We need to fix the kids. We need to fix the future so it doesn't keep happening. So I think we need to put licensed counselors in the school, and I think we need to make it like mandatory that every kid can talk to a counselor at least, I don't know how feasible it is, but give them a schedule. Every kid talks to the counselor. So that way the school knows, hey, this is what's going on at home, and this is a risk for addiction, because broken homes are a risk for addiction. Being exposed to people who take drugs is a risk for addiction. So we're going to have to address that. And in the meantime, we're going to have to do all this other stuff to bring it to a halt. But I would recommend definitely bringing more counselors to schools, because this is an epidemic. And if we look back at our history, we look back at our family history, a lot of times what the parents do, the children do. What the children done, the grandparents have done. So it just is over and over and over. We have to stop the cycle. And in order to stop the cycle, we have to identify these kids who are exposed to it. We have to identify where they live. Is the place where they live infested with drugs? When I was growing up as a teenager, I lived in the projects, and it was infested. I knew where to get drugs. I knew how to get drugs. I could get drugs if I wanted them. Everybody around me was on drugs. I didn't get on drugs, thank God. I'd never even tried them. But those are risk factors, and things would be a lot different today if I had been on drugs, because there was nobody there to identify me and help me work through those. And sometimes people just need somebody to talk to. If you have any questions about this, there are a ton of resources, and I have downloaded some stuff, and you can message me if you want to, or just reach out to your senator, because we really do need to support them, because I do believe some of our government officials really are trying to work really hard at fixing something that's bigger than all of us, and I think we can do it if we work together. Thank you for your time. Sorry I went over 5 minutes, but if you have any questions, again, let me know.